Let's jump up into some heavy stuff, the most dangerous cancers you need to know about, but I promise I'll keep it real. No boring medical jargon, just you, me, and the cold, hard facts about what makes these cancers so serious and what signs you shouldn't ignore. Brain cancer, the silent threat in your skull. So here's the deal with brain cancer. Unlike most cells in your body, your brain cells, especially neurons, can't really replicate. That means if something goes wrong, your brain can't just grow new healthy cells to replace damaged ones. Plus, your brain is crammed inside your skull, a super tight, delicate space. One tiny change and boom, you feel symptoms fast. Brain cancers are pretty rare, only about 1.4% of all cancers in the US. But if a tumor grows in the wrong spot, it's game over for that part of your brain. These tumors don't just take up space, they steal energy by hijacking your blood vessels and rewiring them to feed themselves. That's like an invader setting up camp and hogging all the resources. If this happens near the brainstem, which controls breathing, heart rate, and all the stuff you don't even think about, surgery isn't usually an option. It's just way too risky. Symptoms vary by tumor location, but expect headaches that won't quit, seizures, vision changes, or trouble moving or talking. Bottom line, brain tumors are sneaky and dangerous because your brain is such a packed, sensitive space. Breast cancer, the common warrior. Breast cancer is one you've probably heard lots about, and for good reason. It's one of the most common cancers, especially in women. Around 1 in 8 women in the US will face it in their lifetime. Don't forget, men can get it too, but it's way rarer. It starts when cells in your breast start multiplying like they're in a race, forming lumps or masses. Early on, it might be silent, no pain, no obvious lump, which is why regular self-checks and mammograms are lifesavers. If left unchecked, breast cancer can spread or metastasize to places like your lungs, liver, bones, or even your brain. Think of cancer like a selfish camper who builds a tent wherever it pleases and won't share your food. Symptoms can be anything from lumps, changes in breast size, unusual nipple discharge, or skin dimpling. The good news? Treatments have come a long way. Surgery, whether removing just the lump or the whole breast, radiation, chemo, or a combo, can be super effective, especially when caught early. Lung cancer. Ignites lung cancer is a silent killer and one of the deadliest cancers out there. It makes up roughly 13.3% of all new cancer cases in the US. The major culprit? Smoking. Whether cigarettes, vaping, or other inhaled smoke, about 80 to 90% of lung cancer is linked to smoke exposure. So, yeah, it's often preventable. Your lungs are these spongy organs designed for breathing, but when cancer cells start growing uncontrollably, they form tumors that mess up your breathing and chest function. Symptoms include a stubborn cough that won't quit, shortness of breath, chest pain, and sometimes bloody coughs. As cancer gobbles up lung tissue, fluid can build up, making breathing even harder, sometimes leading to respiratory failure. There are two main types: non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. SCLC is tougher to treat because tumors multiply quickly and are harder to remove surgically. Treatment depends on the cancer type and stage, but typically involves surgery, chemotherapy, radiation, or targeted therapies. Ovarian cancer, the silent killer in women. Ovarian cancer is often called the silent killer because its symptoms are so vague it easily goes unnoticed. It mostly strikes women after menopause. About 90% of cases start in the outer surface cells of the ovary. Risk factors include family history and genetic mutations like BRCA1 and BRCA2, famous because Angelina Jolie had preventive surgery to reduce her risk. Symptoms feel like monthly annoyances at first: bloating, pelvic pain, early fullness after meals. Treatment usually means surgery to remove ovaries, fallopian tubes, uterus, and sometimes adjacent tissues, followed by chemotherapy to kill off any leftovers. Leukemia, the childhood cancer. Leukemia is all about your blood cells. It's the most common cancer in kids under 15, accounting for about 28% of childhood cancers in the US. Here's what happens. Certain white blood cells mutate, grow out of control, and crowd out healthy cells in your bone marrow. It messes with your body's ability to fight infection, stop bleeding, or carry oxygen. The two main types in kids are acute lymphoblastic leukemia, ALL. The most common affects kids 2 to 8 years old. The bone marrow cranks out immature white cells called lymphoblasts insanely fast. Acute myeloid leukemia, AML. Less common but serious, makes immature myeloid cells. Symptoms hit hard: fatigue, bruising easily, infections, fever, and bone pain so bad, young kids might even need morphine. Treatment is intense. High-dose chemotherapy that often causes hair loss, sometimes radiation or stem cell transplant. The good news? Survival rates are improving, especially for all, with about 90% of kids surviving 5 years or more. Skin cancer, the surface battle. Skin cancer is the most common cancer in the US. Almost 1 in 5 Americans will develop some form in their lifetime. Your skin is constantly renewing itself, but too much sun exposure, especially UV radiation, can damage your DNA. Damaged skin cells can go rogue and multiply uncontrollably, causing skin cancer. Melanoma is the most serious type. It starts in pigment-producing cells called melanocytes. It can spread fast if left untreated. Look out for changes in moles or new unusual spots that grow, change shape, or bleed. Symptoms can vary depending on whether it spreads, causing coughing or seizures if it reaches lungs or brain. Treatment usually involves cutting out the cancerous growth, sometimes followed by radiation or chemo. And here's a fact: sunscreen isn't just hype. For less than $10, it can hugely cut your risk. Don't skip it. Pancreatic cancer, the painful silent killer. Your pancreas is crucial for digestion and blood sugar control. Pancreatic cancer is nasty because it grows silently, often unnoticed until it's advanced. The tumor puts intense pressure on surrounding nerves, causing brutal, constant abdominal and back pain. Pain meds help little. Other signs include unexplained weight loss, yellow skin and eyes, jaundice, nausea, and vomiting. The cancer basically makes your pancreas start digesting itself. Unfortunately, pancreatic cancer is usually diagnosed late, making surgery tricky or impossible. Treatments include surgery and targeted therapies, but the prognosis is often tough. Thyroid cancer, the neck's secret. The thyroid, a small butterfly-shaped gland in your neck, controls your metabolism and mood. Thyroid cancer is less common but has been rising. It's more common in women and usually strikes between 25 and 65 years old. Cancer here can spread fast through the neck's lymph nodes, your body's highway system for fluid, so it can travel anywhere. Early signs are lumps in the neck, trouble swallowing, hoarseness, or a persistent cough. Good news: many thyroid cancers grow slowly and respond really well to treatment. The 5-year survival rate is about 98% when detected early. Oral and throat cancer, the hidden mouth. These cancers can affect your lips, tongue, throat, or tonsils. Risk factors include tobacco use, heavy alcohol drinking, and HPV infection. Symptoms start subtle: mouth sores that don't heal, persistent throat pain, or voice changes. If ignored, they can spread quickly to lymph nodes and beyond. Treatment usually includes surgery, radiation, and sometimes chemotherapy. Staying alert to early signs is key because early-stage detection drastically improves outcomes. Liver cancer, the silent metabolic giant's downfall. Your liver is the body's powerhouse, handling detox and digestion, but liver cancer often flies under the radar until it's advanced. It can develop from chronic liver diseases like hepatitis or cirrhosis. Symptoms might include abdominal pain, swelling, jaundice, yellow skin and eyes, and unexplained weight loss. Because the liver is super rich in blood vessels, cancer here spreads quickly. Treatment options are limited but include surgery, liver transplant, and targeted therapies. Early detection is tough, which makes liver cancer one of the more deadly types. Esophageal cancer. Esophageal cancer affects the tube that connects your throat to your stomach. This one's tough because it usually doesn't cause symptoms until it's pretty advanced. When symptoms do appear, you might have trouble swallowing, persistent heartburn, chest pain, or unexplained weight loss. Major risk factors include chronic acid reflux, GERD, smoking, and heavy alcohol use. The cancer can block your esophagus, making eating painful or impossible, which can lead to serious weight loss and malnutrition. Treatment depends on the stage but often involves surgery, radiation, and chemotherapy. Because of its late detection and aggressive nature, esophageal cancer has a challenging prognosis. Multiple myeloma, cancer in your bone marrow. Multiple myeloma is a cancer of plasma cells in your bone marrow. It's sneaky, causing bone pain, fractures, fatigue, and sometimes kidney issues because of excess proteins released. Because symptoms mimic other conditions, it's often diagnosed late. Treatments include chemotherapy, targeted drugs, and stem cell transplants.